Hi everybody. This is Himanshu. I'm by profession I'm a software engineer, but I'm super passionate and excited about being a featured coach with Global Fitness Clan. So today I'm going to interview my client who's recently transformed, Dr. Bhupali. Dr. Bhupali, are you here? Just give me a second. Yes, she's here. Nice. So coaching Bhupali was altogether a different experience for me because she's a doctor. मुझे भूपाली को कोच करने का privilege भी मिला क्योंकि she you'll get to know a bit more about her profession, but I also got to learn so many things from her because of her experience. So without any much delay, let's get the interview started. So Bhupali, why don't you unmute yourself and introduce yourself to the audience today? Yeah.
Yes,
Yes.
very good. Hi everyone, good morning. I'm Dr. Bhupali Jadhav. By profession, I'm a doctor and I've been practicing since 12 years in a corporate multi-specialty hospital in Pune. And my main area of work is in the intensive care unit and emergency department.
All right. All right. So, 12 years of experience, a senior doctor who takes care of emergencies, casualty department, and ICUs. All right. So, Dr. Bhupali, when you approached me for your consultation for the program, what was your health status back then? Could you just brief about that?
Yes. I am in a healthcare profession and juggling between all emergency duties and night schedules, OPDs. I was not able to keep up my health, or rather, I was not able to keep a healthy lifestyle. And this resulted into a weight gain of around 12 kgs. And along with that, I had constant leg cramps, leg pains. During my duty schedules also. The main thing was about so many gastric issues. So it was indigestion, constipation on and off, and gastritis, which I used to suffer every now and then, like every week or so. And for that, I always used to have to take antacids and antiemetic pills, and also some antacid liquids. Sometimes, though, even in case of emergencies, I had to take IV like injections, antacids, and then I could resume to my duties. This was the main thing. Again, there were bouts of migraine also. Uh, Headaches were constantly there along with me. In my bag, I used to keep all painkillers. The Brufen was a savior always in case of migraine. I used to pop up Brufen all the time, sometimes 3 times a day also. And that used to give me relief from migraine. Along with leg cramps, I had ecchymosis. So these ecchymosis are, in simple terms, you can say it as bruises, which are caused by blood leaking from small blood vessels, and then the blood leaks into the skin. And this was also which I was suffering from. Low energy levels, all the time feeling sleepy, not feeling to go to the OPD or to the duty. So these were all the things that I was suffering.
Right, all right. I mean, quite a lot health issues you had back then, I remember. Another question I have, I mean, usually we don't ask these to our clients, but since you are a doctor, such a with lot of experience, what made you approach me? I mean, I'm a software engineer turned health coach, right? And you work in a corporate hospital and such long experience. What gave you belief and what was your mindset back then? Even I'm curious to know. I did not ask this to ever to you.
Basically, I had realized this that while treating the patients or handling any emergencies, there is all knowledge that we have about the medicine, about the disease. But when it comes to prevention, personally, what I felt is my knowledge is like just uh, up until vaccination and not beyond that. I had so many dietitians along with me working in the hospital, and I tried to follow the diet plans that they gave me, but somehow I realized that these kind of generalized diet plans were not working at all for me. एंड जैसे हर कोई करता है गूगल करके कुछ टिप्स मिल जाए, कुछ यूट्यूब पे किसी का वीडियो देख लिया कि ये पी लो या ये कर लो, सो दैट विल help me, and I even tried that, but then I realized that this is not going to work, and I need a guidance, a constant guidance and support. And once I consulted you, I knew that this diet plan and this guidance would be is actually for me, and it is very easy to follow even during my busy schedule. And so I just started with the
Nice,
diet.
nice. Got it, got it. So, after all this, we all are excited to know ki, where does your health stand today after your transformation? That's the victory we all want to know. And also, you can share a bit about that when you joined the program with me, right? What were your what expectations you came within, and where do you stand today? So, go forward.
So the expectation, I would say, I had just only come for weight loss. I there were during our consultation also, I had not told any of these things about. I think only the gastric thing I had told you, nothing other than that. So I was expecting only the weight loss, which it happened with your constant guidance and support, and I'm very thankful to you and the GFC philosophy for that. But what came as a surprise for me was my like migraine is now not a part of my life. Like from 7 to 8 months, I don't remember I have taken a single brufen pill uh, for migraine, because I didn't don't have any migraine or any headaches for that matter now. Gastric issues are like there's no gastric issues now. Gastritis, which I used to have every week or so, I don't have that now. And the main surprise was of ecchymosis, because that too was not in part of our consultation anywhere. I suddenly realized in past 2 to 3 months that I don't have that ecchymotic patches again. So these were all the things that these have came as a surprise for me. And talking about energy levels, so now I can I can see a boost of energy levels in myself. Like even after coming from night shifts, I work out, and I don't feel that requirement of sleep, or I'm getting tired or exhausted. I have been religiously doing Surya Namaskar, and I have seen quite a shift. Now I can do 80 Surya Namaskars on a go, which was not like that. It was like just 10 or 12 in the beginning. But thanks to the diet that I'm following, and the GFC philosophy. And with this, I have become so much inspired from you also, that I have now decided to not take any medicine or pills until there is an absolute emergency. And from January, as I had told you, that I have been not on any painkillers or anything till now. So this is my next health goal of not taking pills on and off.
Awesome, awesome. I mean, what a victory, Dr. Bhupali. It's just amazing. I mean, from eating three painkillers in a day and now deciding to live a medicine-free life, it's totally amazing. So now, congratulations, and I would like to show your transformation also to everybody. So here's Dr. Bhupali's transformation. She's lost 12 kgs of weight, but the real victory is जो उनके इश्यूज जो सारे हेल्थ चैलेंजेस अभी गायब हो गए हैं, राइट? माइग्रेन नहीं है, डाइजेस्टिव इश्यूज इंप्रूव हो गए हैं, इकाइमोसिस जो स्किन पैचेस आते थे वो गए हैं, लेग पेन, एनर्जी लेवल्स जस्ट अमेजिंग. So, Dr. Bhupali, I mean, I want to take a deroute from our interview. And since you are a doctor, you work in emergency care, you see so many patients in casualty ICU, right? Uh, I want to understand and ask you for benefit of everybody today here कि मतलब वो कैजुअलिटी आईसीयू में कोई नहीं जाना चाहता, या फिर वी डोंट वांट अ फैमिली मेंबर्स टू एंड अप देयर, राइट? It's so hard, right, that phase. So from your experience working in an ICU for so long, and then looking at experiencing the preventive healthcare also through GFC. What message or what insights do you want to give to people today?
Yeah, so I have been working in intensive care units and emergency departments since around 12 years, as I told. And so I have realized this thing. Of course, after I have started my GFC journey, that 99% of the emergencies are just, mismanagement of the metabolic disorders. Or not taking preventive care or preventive measures, enough preventive measures. And only 1 to 2% are the real emergencies, that is the road traffic accidents which happen or so. The 99% which things, emergencies that come are just, high blood sugar levels, sometimes very low blood sugar levels, which we call hypoglycemia, or sometimes stroke, in simple words like paralysis attack, accelerated hypertension. So all these things are just purely mismanagement of these metabolic disorders. And when people fail to realize the importance of lifestyle changes, nutritious diet and stress management, all these things are not done in a better way previously, or rather people are also not aware of these things. And we as a doctor also are, mind is programmed that you just have to take medications for everything. But why not look into the preventive measures? Why not go for lifestyle changes, go for better stress management, because things don't happen all of a sudden. Nobody will land up directly into the emergency department with a stroke. There is a lot of piling of issues over many years. And throughout these years, people have not taken care of their health, and they land into emergency department. So now I have I have developed a true faith in these preventive measures rather than curative. So if we focus, or if we give importance to prevention today, then it is very much avoidable, like the to avoid the cost of cure in the future. So I would suggest that we should go towards lifestyle changes, stress management, and have a holistic diet to avoid all these emergencies. And it can be done 100% for sure.
मौसम सच अ इम्पोर्टेंट मैसेज डॉक्टर भूपाली ने हम सबको दिया है कि कैजुअलिटी इमरजेंसी से कोई रैंडमली नहीं आते हम हमारे सोसाइटी में सुनते हैं ना ये कि दिस गाय वाज लाइक कल तक ही वाज वेरी फिट हैप्पी एंड अचानक हार्ट अटैक आ गया, अचानक स्ट्रोक आ गया। कोई भी चीज अचानक नहीं होती, इट्स रिजल्ट ऑफ लॉन्ग टर्म स्ट्रेस, पुअर डाइट मैनेजमेंट, टॉक्सिसिटी, एवरीथिंग। एंड इन जीएफसी GFC program, we follow complete wellness where we are taking care of your diet, hormones, inflammation, toxicity, stress, sleep, every single thing. And if we follow it religiously and we get our families also on the program, there's very less or almost zero probability that will end up in a emergency situation, right? So coming towards the end of the interview, Dr. Bhupali, I want to ask you, after your transformation, you've decided to be a health coach with GFC. You are in the selection, you followed the selection process. Now you're in the learning phase. So what really inspired you? Because you already have a hectic duty hours, right? You work so hard, you have tight duties, and कभी कभी 12 घंटे की ड्यूटी इन एन कैजुअलिटी और आईसीयू, इट्स ऑलरेडी enough exhausting. What inspired you, and what was why did the mindset shift happen?
So I would like to tell you that in spite of being in spite of myself being a doctor, I had always that constant fear of diseases, and a constant fear of taking medicines. And when I went through my own transformation journey, and I saw so many clients getting transformed, getting their diabetes reversed, no medications for hypertension, PCOS. which somewhere previously, before 1 to 2 years back, I was programmed that diabetes, hypertension, PCOS, and all sorts of autoimmune disorders are not at all curable, and you have to take medicines for that. And that programming had developed this fear of diseases and fear of taking medicines, which I was passing on to my patients, or maybe to my relatives also. But when I saw my own transformation journey, when I got rid of my migraine, that was the point which made me just stress free and worry, free of all worries. That yes, all these metabolic disorders can be reversed. I was completely not in favor. Like, कभी डायबिटीज भी रिवर्स होता है क्या, ऐसा तो मैंने कभी भी नहीं सुना था. And this came as a surprise for me. Initially it was hard for me to believe that all the metabolic disorders can be reversed and patients can be put off medications. But seeing all these clients transforming, getting transformed, this has just developed my faith in the GFC philosophy in preventive measures. And after joining GFC, I have read so many books which I don't know. I mean, I would not have read. And through these readings, I came across a very good quote by Thomas Edison, that the doctor of the future will give no medicine, rather will interest his or her patients into taking care of the human frame, and in diet and in cause of prevention of diseases. So this was very inspiring for me. And now I have a total or 100% a firm belief in GFC philosophy and diet. And so this is what I have been inspired with. And I have always tried to, acquire and enhance my skill sets. And seeing all these things, I have known the power of nutrition and lifestyle changes and prevention. And this I'm considering this as my new skill set to help my patients in a better manner. And this is what I have been inspired by, and I'm looking forward to treat as many patients. Now I don't like to call them patients. It's now clients for me. As many clients I can, to make them disease free and medications free.
Amazing, amazing, Dr. Bhupali. More power to you. As you said, doctor of future will not give treat his patients with medicines. I mean, you are already in a noble profession, but when a doctor decides to practice and take seriously the preventive side of it also, the profession becomes more powerful and the noble profession becomes nobler. I don't know if it's grammatically correct also, but just amazing. And I'm so looking forward to your journey and the impact and influence that you create in the society with your preventive as well as curative uh, strengths, right? And uh, congratulations to you once again. And uh, I mean, uh, one thing that I want to appreciate you is, right, when you came in as a client, you never came, you did not have any professional ego. You were submitted to the program, the process, and that's why we can see the mindset shift and also the results, right? And I can't, I'm so excited that how our society's healthcare will turn when more doctors will, have mindset shift like you, and it would be just amazing place, right? So thank you, Dr. Bhupali, for sharing your heart so honestly and sharing your insights and experience with all of us. It was great learning for everybody today.